As a clinical interventional radiologist who's been leading and collaborating with cardiology, vascular surgery, and thoracic surgery for more than 30 years, Dr. David Williams is an international authority on endovascular treatment of aortic dissection, especially the diagnosis and treatment of related malperfusion syndromes. Dr. Williams is the Kyung J. Cho Professor of Radiology and Professor of Internal Medicine at Michigan Medicine at the University of Michigan in Ann Arbor, where he has been a member of the faculty since 1983. In 2015, he received the university's League of Clinical Excellence Award. A Michigan native, Dr. Williams earned his bachelor's degree from Mary Glade College in Memphis, Michigan, and a master's degree from Wayne State University in Detroit before serving 3 years as a Navy medical physicist. He attended medical school and completed his residency and IR specialty training at the University of Michigan. Dr. Williams co-moderated the first SIR workshops on endovascular aneurysm repair implementation using fluoroscopy. He also co-moderated workshops on venous recanalization for several years to share his expertise on this minimally invasive procedure. His clinical areas of expertise include opening blocked arteries and veins, plugging arteries supplying tumors, uterine fibroids, vascular malformations, aneurysms and abnormal bleeding, and aortic aneurysms and dissections. He is also the author of more than 200 peer-reviewed articles, principally on these subjects. Even though the spotlight is on Dr. Williams and our other honorees, he noted that he owes a debt of gratitude to mentor and colleague Dr. Kyung J. Cho. As a world authority on carbon dioxide vascular imaging and venous sampling, as well as a 2012 gold medalist himself, Dr. Cho was instrumental in helping Dr. Williams shape his own IR philosophy. Now, let's hear from a few colleagues who are equally grateful for Dr. Williams and his contributions to the field.
David, congratulations on this important honor. It's so well-deserved. And I think that no matter what field you touched, you would be honored in the same way. We're just so fortunate that you chose interventional radiology as your field, as a practice, as your career choice. I can't think of anyone more deserving for a number of reasons. The fact that you are a world-class interventional radiologist is actually lower on the list of reasons why you should be recognized. As a friend, as a mentor, as a family man, as a father, those reasons really stand out in my mind. And I'm so happy for you and so proud to know you. And I want to thank you for the impact you've had on my career and my life.
Dr. Williams means the world to me. He has been an inspirational physician and human being who has positively affected my life and my career, as well as that of thousands of patients over his over 40 years of experience in interventional radiology. Dr. Williams has inspired me to take care of my patients in more innovative and more thoughtful ways. And has also inspired my career in advancing interventional radiology through research and science in countless ways.
Since 1982, I have had the pleasure of working with Dr. Williams at the University of Michigan. Dave is an outstanding interventional radiologist, having performed the most complex, challenging endovascular procedures with remarkable energy and determination. Among many scientific contributions he has made, his work on the pathogenic mechanism underlying aortic disease and dissection is the most significant, and his innovative spirit has led to the development of modern percutaneous management of aortic dissection with fenestration technique and stent placement. It is my great pleasure to congratulate Dr. Williams on receiving this gold medal award from the Society of Interventional Radiology.
The Society of Interventional Radiology is honored to recognize Dr. David Williams.
Good afternoon. I owe this honor to many people, in particular to my wife and children, who for years have put up with my long hours and unpredictable schedule. I thank my colleagues in interventional radiology, particularly decades-long comrades Narasimhan Desika, Wojciech Schwikl, and Kyung Cho. Finally, I thank my colleagues in vascular and thoracic surgery. Patriarch surgeon Marty Lindenauer told me, "Go ahead, do it. We have nothing better to offer." Several hours before my first fenestration, when I discussed what might go wrong, and he surmised that I was getting cold feet. I thank colleagues and surgeons, Thomas Wakefield, Michael Deeb, and Himanshu Patel, who supported me over the last 20 years. The unified and cooperative effort to match therapy to patient anatomy animated all my IR and surgery colleagues and accounts for our clinical success in treating anatomical complexities like aortic dissection with malperfusion and IVC agenesis with fresh and bulky iliofemoral clot. It never crossed my mind that this might be gold medal work. After I got the phone call from Linda Findice telling me of the award, I gave the gold medal more thought. I realized that the award recognizes devising revolutionary inventions, devising effective and minimalist treatment for neglected or abandoned patient cohorts, proving long-term efficacy in medical conditions like liver cancer or portal hypertension, and so on. In most cases, the gold medal awards an enterprise. What this means to me is, although the award is coming to me, without my family, without my colleagues and the spirit at Michigan, it never would have happened. Thank you very much.